We've got one of our guests. So the efforts are being done by the health officials with Dr. Fahad al Qamlas, Director of the Public Health Department at the Ministry of Health.
Thanks for having me.
Good evening, Dr. Fahad al Qamlas.
Yes, thanks for having me.
Yeah, thank you. Thank you for being with us in our show. Doctor, could you tell us briefly about the efforts made by the Ministry of Health to ensure an easy flow of the voting process today?
Sure. The Ministry of Health had started the process actually a long time ago when the time was set for the date of the elections, and the challenge was as we're facing the pandemic of COVID-19, we actually when we meet something like mass gathering challenges, and as many of the viewers know that the pandemic is related to an infective process that is closely related to mass gathering. So for a long time, we've been preparing for all preventive and possible preventive measures that can be taken into consideration during the process of the election. As you may know, that the Ministry of Health had always been involved in the election process in terms of having resuscitation teams, nursing, and also diet and nutrition part. But for the unusual circumstances of COVID-19, this year we had introduced a new challenge of having the preventive medicine sector and public health to be involved in battling the case of any possible infectivity or contracting the infection between the public.
Doctor, can you tell us a little bit more about the presence of the Ministry of Health and the various ballots locations, and what did they provide in terms of assistance and safety precautions for the citizens?
Absolutely. So for the precautionary measures, we had probably two main arms at the level of public health. We had the preventive medical team that has been distributed across all locations of voting, including preventive physicians and also health inspectors, as well as infection control nurses. We had almost 200 employees from the public health sector to be distributed across all locations of voting. Those were serving or supervising the preventive measures that has been prepared in order to protect the public from contracting the infection, being specifically having measures for physical distancing and wearing appropriate face covering of the nose and mouth all the time, and also having the precautionary use of gloves during the voting process, making sure that the public clean or use the alcohol to clean their hands frequently. So these are this is one of the arms that we use in the preventive measures. We also had another white army, if you allow us to call ourselves a white army, and that was the team of the electronic application of making sure that people who actually have the disease or the individuals who are under quarantine because they're close contacts or that they arrived to the country recently from abroad, that they're under quarantine. And I'm talking about the application named Shlonik that is quite popular now across the country. So we had Team Shlonik that was also distributed across the locations of voting, making sure that we actually have all the data and making sure that we have a good database that is available for us to make sure that we isolate then the cases and make sure that all preventive measures are taken into consideration while during the voting process.
Right. That was great, Doctor, that you mentioned that, because earlier we were talking about the people infected with the COVID-19 and the great initiatives that the government did by allowing them to go and cast their votes. Now, from what you saw today, were there any cases, for people infected with COVID-19, or did you face or heard about any difficulties for them going to those schools to cast their votes?
Yeah, so the difficulties were actually identifying the cases and making sure that they are allowed to complete the voting process in the appropriate places. So the process that was organized through the Ministry of Health and specifically through the electronic application of Shlonik was allows the person who's either who had contracted the infection, who has the disease, or those who are under quarantine. They're both allowed. They were all sent an SMS message earlier today, in the early morning hours, and giving them instructions about how to proceed with the voting process in case that they're interested to do that. They were directed towards opening their Shlonik application, going to the page of requesting a medical assistance where they can get a permit and choose the time that suits their needs, and give them sort of a window for them to go and cast their voting, and then of course, the more important thing is to ask them to come back and return to their isolation or quarantine location immediately.
Yes. And now, Doctor, for those special centers or schools that were set up for that, were there special measures taken for the staff working there, whether the people from the Ministry of Interior or the judiciary staff? Did you take extra precautions, or could you tell us a little bit more what kind of measures were taken for those special centers?
So the restrictions and the special measures were applied in all locations, assuming that any case is a possible case of infecting other people. So restrictions were taken to a high standards in all 107 locations where, as we say, face, hands, and distance. So cover the face, clean the hands, and maintain a social distance between each other. The extra precautionary measure that was taken by the state at the state level was to make sure that 5 sites are allocated for people who have the disease in each of the circles of voting. So if you're located in the first circle, you would be directed to go to the voting location allocated for people with the disease who actually who can cast their vote at that specific location. And the reason behind this is just to get more extraordinary precautionary measure to isolate those individuals from the rest of the voters, so they wouldn't mix with the rest of the voters, and we limit the possibility of transmitting the infection to the lowest level.
Thank you, Dr. Fahad, so much for being with us, and thank you for all these information that you have shared with us. Now, we're going to take a short break, and we will come back, and I think the news team have something special waiting for you after the break.